Infections in the tonsils are very common, especially in children and even in adults. Due to the lowered local immunity, the infection happens in the tonsil in adults. These tonsillar infections, due to the chronicity, will cause the pus exudate to come from inside the tonsil to the surface and form concretions on the surface of the tonsil. These concretions can harden and become stone-like, and usually they have offensive odor. Regular oral toilet with warm, alkaline, salt water is a good way to protecting your throat. Taking medication sometimes is necessitated to bring down the infection. That said, it is always essential that one takes the right kind of advice and treatment to bring down the cause for the tonsil stones rather than treat the stone. There's nothing to treat with the stone, but sometimes these concretions can become very large, like hardened, and become horn-like, and will have to be removed surgically. Tonsil stones, as they are called, are not stones but just concretions which have hardened on the surface of the tonsil, and they have to be treated with the right kind of medication to bring them down. Namaskara. My name is Dr. Harihara Murthy. Tonsils are the glands situated in the back of the throat, behind the tongue, below the palate. These two tonsils on either side are part of a ring of tissue, one at the back of the nose in the nasopharynx known as the adenoids, and one at the back of the tongue known as the lingual tonsil. These four organ systems are part of the protective mechanism in your throat to prevent infection going lower down. Remember, when children take something and put it in the nose, or bacteria go through the nose into the throat, or you put something into the mouth, the child normally takes things and puts in the mouth. It's a very atavistic property to see whether the food in the mouth or what object is put in the mouth is edible. So they smell it and see, they put it in the mouth and see, and these things can carry bacteria which go inside. So nature has given the first 4 years for protection through this system of the adenoids and the tonsils in the throat. Now, the tonsils can themselves get infected as part of the process. As a result of that, one can have infection in the throat causing pain, discomfort, bad smell in the mouth, as well as difficulty in swallowing. When somebody looks into the throat, you will see sometimes spots like strawberry. The tonsil has got pits, which are the openings of the lymph ducts inside the tonsil, the lymphatic tubules, which collect the infection from the different parts of the tonsil and push it out. And this exudate is what can coalesce on top of the tonsil and look like a whitish or a dirty whitish discharge which is covering it like a membrane. This thing is known as pseudomembranous tonsillitis. When only the spots are seen, it's known as follicular tonsillitis. Nonetheless, these are infections which have to be treated professionally and properly. The reason being, if they are not treated well, the infection can lurk in the tonsils for long periods of time and lead on to complications that one doesn't need. It's very eminently treatable, easily avoidable, and making sure good oral hygiene is maintained, especially in children, making sure that children don't eat anything that's not properly cleaned, not raw, cooked properly, so that the child is protected from infection. Having said that, the initial immunity comes from the tonsils. So bits and pieces of infection that may go into the throat stimulate the production of antibodies, and initially the children's immunity is developed through the tonsil. So they are a necessary part of the immune system between 2 and 4 years of age. Till the age of 4, these are necessary and required. Thereafter, they lose their ability to themselves produce immunity. So after 4 years of age, they hardly participate in the immunological process, as a result of which sometimes they become infected and become problematic for the person. So these are situations that can be avoided by making sure that one, after the age of 4, one is given proper medication when required to quell the symptoms at the earliest. Apart from that, taking precautions like avoiding unclear sources of food and ensuring that you have properly cooked food, making sure water is properly sterilized, These are the normal sources of infection. So avoiding these things. Using a mask in places where they can perhaps pick up an infection. For example, if somebody is going to public places where there are a lot of people and you do not know who those people are, wearing a mask is no harm. We always did it during COVID for a couple of years. We wore a mask with a lot of reverence at that time. I think that reverence to your body is required even now. When you're in public places where you're not sure of the place where you've gone to, wearing a mask is no harm, it's no disrespect to anybody, it's just protecting yourself. These are things that one should do.